Yes. Hello everyone, welcome back to Oliveboard. Myself Jay Sharma, and today we are going to discuss one important news event that was recently in PIB. And PIB is a great source for this examination where they give news in a comprehensive manner. For example, this particular news event is about the TB free India. Right? Government wants to free India from the TB. So in that scenario, we will be seeing that what are the achievements, what are the scenarios with respect to India or with respect to the global scenarios, what are the challenges we are facing, that why we are not yet able to eradicate the poverty, and what more could be done, right? So these will be the basic scenario. So first of all, let us just understand the overview of this particular news event, that India's objective is to eliminate the tuberculosis, that is TB, by 2025, right? So that was India's target here, that is 5 years ahead of the sustainable development goal target 2030. So that means the United Nations has said that we will be eliminating TB in 2030, but India said that India will eliminate tuberculosis by 2025. So that means there would be not much occurrence of this particular disease. So in that scenario, the Prime Minister Narendra Modi has reaffirmed its recent commitments at the End TB Summit. So this was in 2018, where Prime Minister Modi has said that we will be eliminating TB by 2025 in the End TB Summit, and again in the One World TB Summit in 2023. So if we discuss about this progress, that okay, India has committed that they will be eliminating TB by 2025 and we are living in 2024. So that means we have almost 14 months from today. Not exactly 14 months, let's say we are saying that we have just 13 and a half months from today to eliminate TB officially from India. So if we talk about the progress we are having, that at present we have 17.17% decline in TB incidence, right? So that means this was between 2015 to 2023, that in these 8 years we have declined TB occurrences or incidences to 17% as compared to the global average of 8.3%. So that means if we compare India with the global average, we are performing better, because at the global level they has been decreased by only 8.3%, whereas if we talk about from the India level, we have decreased by almost 17.7% from the TB. So that was a very good scenario. But if we go by certain reports by World Health Organization, so you will observe few things, that what actually WHO is trying to say about tuberculosis. So the foremost thing, that there was a report of global tuberculosis report in 2022 by World Health Organization. They have highlighted few things. Among them, the first thing is that the COVID-19 pandemic has reversed the years of progress made in the fight to end TB. So that means we were, from the global level, we are saying that we were doing good, right? We were doing far better from as compared from the previous year. But after COVID-19, the occurrence of TB has been increased. So whatever the progress we have made before COVID-19, that has been reversed. Now, why is that particular event? Because what the most thing that has been observed in COVID-19, that majorly people were focusing on immunity. I mean, during COVID-19, people started observing that, okay, we want to focus on immunity. And during COVID-19, we had almost most of the citizens of the world, they had exposure with the COVID-19 virus. So once that virus has exposed them, that has decreased their immunity, and they have came in contact with the bacterium that has been causing tuberculosis. So in that scenario, WHO is saying that it has been continuing to have a damaging impact on access to TB services. That means people are not been able to access the TB services. Okay. Now another thing that they have highlighted, that 1.6 million TB deaths has been observed, including 1,87,000 TB deaths among people with HIV. Right. So TB is one of the top infectious killers worldwide, including HIV. So TB is also the leading cause of deaths among people with HIV and have a major cause of antimicrobial resistance related deaths. So that means TB has developed antimicrobial resistance. So what is the meaning of antimicrobial resistance? That means the occurrence of superbug. What is superbug? That we are giving the doses, we are giving the drugs, but the virus that we are having inside of TB has developed resistance against those drugs. So that means even though you are using those drugs to decrease the incidence or the occurrence of TB, but it is not actually being helpful. Now there are a few things that has also been observed by WHO, that or by 2000 to 2021 almost 74 million lives have been saved. So that means, okay, we are doing good, but the drug resistance in TB remains a public health crisis, that the bacteria has been resistant towards the drugs, right? So only about, and another thing that has been observed, that only about 36% of people has access treatment of those in need. So that means if 100 people has infections of TB, among them only 36% has the accessibility of worldwide. We are talking about the worldwide. This is the worldwide data. Only 36% of the people has access to the treatment of the tuberculosis. And if we talk about the diagnosis or the required amount to have this diagnosis, so in 2022 there was a requirement of US $13 billion, but the actual spent was only $5.4 billion. So that means this is a very huge gap, right? Another thing that WHO has highlighted, that with respect to the research, we need another US $2 billion per year for the research, but there has been a funding gap of $1.1 billion, right? So this was from the worldwide point of view, right? But if we talk about from the Indian point of view, then we can say, if we look towards this chart, we can observe the data from past 22 years, that is from 2000 to 2022, under which WHO has again said that the occurrences of TB in India has decreased from 322 to somewhere around 200, then again raised, and now it's around 190 by till 2022, right? So that was the point of view of India's occurrences, right? Now if we talk about from India, that more geographical region, then I mean, whatever the color you are saying, the darker blue, that means we are performing very good, and the most red one, that means it is the worst, right? So by this way you can figure out that which particular region has more of the occurrences, or which particular regions are in the medium term, or which particular region are performing much better as compared to the other kind of region. So this again is data from the World Health Organization. Now if you talk about the global scenario, then we can say that if you say that the number of incidents, it depends upon the size. The smaller the size, the less number of the incidents, right? If we talk about the India, then India, this is the particular incidence of India, that is almost 2 lakh incidents per year, right? So that has been observed by World Health Organization. So this is again a very good figure that has been explaining that why there has been a huge occurrence and we are yet not able to eliminate TB. But yes, government is assuring us that we will be eliminating TB by the end of the next year. Okay. Now, if we talk about the certain preventive measures and collaborative efforts that has been taken, then we can say that the TB preventive treatment, they have been explained about the TB preventive treatment that has been expanded access with 15 lakh beneficiaries treatment prevent TB in vulnerable population. Then comes the collaborative health initiative, that is address the coexisting conditions, malnutrition, diabetes, HIV, substance abuse. So what the WHO has highlighted, that the people with comorbidities, like I mean that we have also heard in COVID-19 that the people with asthma or any kind of diseases like diabetes or sugar, they are more prone towards the COVID-19. So similarly, we are saying that if the people are malnourished or if the people are diabetic, if the people have HIV, they are more vulnerable towards this tuberculosis disease. Okay. Now, there has been a collaborative health initiative that is address. Yes, we need a partnership with other ministries for holistic patient support and improved outcomes. They have also discussed about the impact that we need a dedicated efforts that will underline India's commitment to TB-free nation by 2025. There are several key strategies and patient support initiatives that has been taken by India. That is the National Tuberculosis Elimination Program, that is NTEP. Now, this program has been aligned with National Strategic Plan 2017 to 2025, 2023 diagnostic, or where 1.89 crores sputum smear test and 68.3 lakh nucleic acid amplification test has been concluded. There's been also a concept of direct benefit transfer under the Niskay Poshan Yojana, which has disbursed around 2,781 crore to 1 crore beneficiaries. There has also been a comprehensive care package that has decentralized the TB services, the shorter oral regimes for drug resistant TB patient. Right. So these were the major things that we need to understand about the TB. But if we talk from that, what kind of question that can be asked from the exam point of view, that the first question is that consider the following statements about India's National Tuberculosis Elimination Program, that is NTEP. So we could say that India has committed to eliminating TB by the year 2025, 5 years ahead of the global sustainable development goal target. So that is the right answer, right statement. Second is NTEP includes direct financial support to TB patient through the Nishkay Poshan Yojana. That is also right. Third statement is India's TB incidence rate declined between 2015 to 2023 exceeded the global average decline reported by WHO. So that is also right. So based upon this, we could say that all the statements 1, 2, 3 are correct. Second question is about assertion and reason, under which we can say that first statement is India has implemented a national tuberculosis elimination program aligned with National Strategic Plan 2017 to 2025 to tackle TB cases. Right. So this statement is right. Second statement is under NTEP, TB patient in India receive direct benefit transfers through the Nishkay Poshan Yojana to help with nutritional support. So this statement is also right. So based upon this, if we select the option, that first option is both A and B are true, that is true, and R is the correct explanation of A. So is R the correct explanation of A? That is right. Right. So based upon this, we could say option A is the correct answer. Last question is that according to the World Health Organization's Global Tuberculosis Report 2024, what was the decline in TB incidence in India from 2014 to 2023? So we have already seen the figure. It is 17.7%. Right. So this is it from today's video, where we have discussed a very important news that India wants to eliminate the TB. And they are what kind of measures India has taken, what are the challenges we are facing. We have even compared India with the global scenarios, and we have also seen what more could be done. Right. So see you all next time. Till then, stay safe and study well. Thank you.